fellow Americans. In the next couple of weeks, our hospital ship, the Comfort, will head to New York City. Concurrently, we have a number of military field hospitals and expeditionary medical units on prepare-to-deploy orders that will be moving out this week. The Army Corps of Engineers is also set to begin work to convert buildings into temporary medical facilities across the country. U.S. Army North has activated 10 defense coordinating elements co-located with each FEMA regional headquarters to synchronize requests for federal military assistance. FEMA, as the lead agency for the federal response, will validate and prioritize these requests. The Department of Defense will then deploy our forces around the country to provide this support as directed. Additionally, the department continues to provide logistical support to citizens around the world. Last Friday, for example, we flew members of a U.S. women's football team home from Honduras after the country closed its borders. We continue to keep our service members, civilians, and family members around the world informed on the latest force health protection guidance. Today, we are elevating the Pentagon reservation status to Health Protection Condition C, Charlie. This limits the number of access points to the Pentagon and increases the amount of personnel who will telework, among a few other things. Tomorrow, we will publish updated guidance on elective surgeries as we look for additional ways to free up medical capacity and resources to focus on COVID-19 related treatment. In general, it is important that we all continue to employ protective measures, including good hand washing, proactive medical screening, and social distancing. These can dramatically decrease the risk of infection and slow the spread of virus. We have a number of hospitals and medical facilities, expeditionary medical facilities across all three services. We have put on what we call PTDO, Prepare to Deploy Orders, 5 such units that will be prepared to deploy. We will take our sourcing guidance from FEMA. We will look at sending to other places, and as necessary, we will continue to alert units to prepare to deploy and then deploy them as appropriate. With regard to readiness, we have 133 military personnel who have contracted the virus. We are taking great care of them, watching them closely. I've had a chance to talk to several of them to check on them. As this virus ramps up and spreads, we'll obviously see more and more impact of persons in our ranks. They have some impact on readiness. It will not affect our ability to conduct our national security missions, both at home and abroad, protecting our people and their families, ensuring, safeguarding we have our mission capabilities available to us, supporting the whole-of-nation government effort. We have 16 labs available. We have excess capacity in our labs. There are hospitals being provided by HHS, hospitals in the sense of beds, bed space, things like that. Although we have scaled back some of our major exercises, routine training continues across all services to ensure our forces maintain a high state of readiness. I trust our commanders to make the best decisions for their units as they balance mission requirements with force health protection. I'm proud of our service members and DOD civilians and families who are answering the call all around our great country. I want to thank them for their contributions to this fight. By working together, we will defeat this virus, and I'm confident that our nation will come back even stronger. Thank you.